Well, today I'm at the kitchen table of Dr. Tina Peers. Hello, Tina.
Hello.
Tina, you may recognise the name because she is the expert who provided all the medical information in my book, Confessions of a Menopausal Woman. So we're obviously going to be talking about the menopause, but because we are in Breast Cancer Awareness Month, and we've had so much correspondence from people getting in touch with us with worries about using HRT because of breast cancer, I thought this would be a good time to sort of put a few things straight. So firstly, what are the main concerns that women have when they come to you regarding HRT? Is breast cancer at the top of their list?
Absolutely. So everybody believes some of the myths that are out there about HRT causing breast cancer. And so that's the big reason why many women will put up with numerous symptoms which are making them miserable because they feel that if they go on HRT, they're going to increase their risk of breast cancer. And that's simply not the case.
Okay.
So there are, as I say, lots of myths and misperceptions. Even some of the doctors and nurses who they will talk to about HRT will also believe that HRT is dangerous and therefore women should avoid it at all costs.
And where did this come from? Where did this myth or misinformation, where did it come from?
Unfortunately, in 2002 there was a big study called the WHI study that came out of the States. And it was a very poorly designed study, and it has since been discredited. But you know, we are 16 years later, and still people believe some of the things that were claimed by that study. We know an awful lot more about breast cancer and about HRT and the effect on the body now. And also the kinds of HRT that we use are very different to the kinds of HRT that were used in this study in the 1990s.
There are many different types, aren't there?
There are. So preferentially we go transdermal with the estrogen, and we like to use body identical natural estrogen, and if possible body identical natural progesterone. And we found the data is there to show that these are very safe to take. So each individual woman will have her own risk of breast cancer, and that will depend on her genetics. It will depend on her lifestyle, on her weight, whether she smokes, how much alcohol she drinks, and so on. So they're there whether you're on HRT or not. And going on HRT does not increase that risk if you have the modern HRT that we like to use, the body identical if at all possible. And the other thing that has misled people, I think, with the breast cancer and HRT is that estrogen is a promoter of, it will make, if you have breast cancer cells present, it will make them grow faster. So it reveals the cancer. So in a lot of studies, they have misinterpreted this as the HRT causing the breast cancer.
I see, okay.
Okay, so if somebody goes on into the study and they're on HRT, and then they're 2-3 years later, they're showing that they've got breast cancer, they'll say, oh, it's the HRT that did it. Actually, it takes 10 years for cancer cells to develop in the breast.
Right.
If they are there when somebody goes on HRT, it will reveal the cancer more quickly than if they didn't go on it. But actually, the women who have their cancer revealed when they're on HRT do rather better than the women who discover they have breast cancer and are not on HRT. There is a higher risk of mortality in that group than in the HRT women who discover they have breast cancer.
So for women who have maybe had breast cancer before needing to take HRT, there's a lot of concern that maybe HRT isn't an option for them.
Yes, I think that this is something that we have to deal with case by case, because there are lots of different types of breast cancer, there are lots of different stages, different sizes. Some breast cancers are picked up very, very early, and women are completely cured by the treatment. And then it's a discussion that needs to be had with a menopause specialist, such as myself. There's a team at Chelsea and Westminster where I work. People can be referred in by their GP there. And so the menopause specialist, we have an MDT meeting, we discuss each case. We also discuss it with their oncologist and their breast surgeon, so that everybody is on board with the decisions. But more and more women who have early breast cancer diagnosed and treated are deciding that they feel so miserable without their hormones that they would like to go on HRT. But it is a case-by-case individual decision, obviously. And some women are just not prepared to put up with the miserable symptoms that they can have, and they decide that their risk is so small that it's worth going on the HRT. There is a study that shows that women who are on HRT have a slightly increased risk of recurrence of breast cancer if they've had it before. And there's another study that shows that there's slight reduced risk of having breast cancer. So it doesn't really do either very much. And I think this is very much an individual conversation to be had with the specialists.
It's an understandable worry because, like I say, there is so much misinformation out there. The first port of call that a woman would normally make is to her GP. What sort of questions do you think that a woman who is concerned should go to her GP with? Because what we're finding, and what I'm sure you're finding, is that many times women tend to know more than their doctors when it comes to HRT, to symptoms of the menopause. But what can they go to their doctor armed with to make sure that they get the response they need?
I think there are some useful websites. I mean, obviously your book is a great resource for women to read through and understand about the risks and benefits and so on. I think we've put them in the book quite clearly. We've explained them all. So that's a good starting place. There is a very good Menopause Matters website, which a colleague of mine has put together, Dr. Heather Curry, and she's a menopause specialist, and that's a very useful resource. Also, the British Menopause Society has a very good website called womenshealthconcern.org, and I would recommend that. I think it's mentioned in the back of the book. And so if women can get as much information as possible, then when they go to their GP, they will have an advantage, and they'll be able to make a judgment as to how specialist that GP is and how knowledgeable in the field they are. And some GPs are more interested and are more up to date than others. So it's a question of shopping around a little bit as well, I think. I think something important to point out is when you ask women, what percentage of women postmenopausally, their cause of death is breast cancer, and the man in the street and the woman in the street think it's really high, and it's the number one killer of women, maybe, but actually it's only 4%. So only 4% of deaths in postmenopausal women is caused by breast cancer. 36% of deaths is caused by heart disease. And HRT reduces your risk of heart disease by as much as 50%. So therefore, that's massively protective and helpful and saving thousands of lives every year. It also reduces the risk of bowel cancer by 30%. And that is the second most common cancer in women postmenopausally. It reduces the risk of dementia by 30%, which is massive protection, and reduce the risk of Parkinson's disease, which is more common in women than men. It reduces the risk of, of endometrial cancer if you're on continuous combined HRT. It also improves your cognitive function, your well-being, your mood, your energy, your sleep, your joie de vivre, your sex drive. It's all important because it's who we are, isn't it, really?
What sort of questions do women normally ask you when they come to see you? What is it a quest for knowledge, or is it coming to you with symptoms and not knowing where to start? Usually
they come quite frightened because they know they're in a bad place, and they often have multiple symptoms and are feeling pretty grim and have put up with it for some time by the time they pluck up the courage to come and see us. But when they do then come and see the medical profession, they are full of questions about what about breast cancer, what about blood clots, what about osteoporosis and so on. HRT prevents osteoporosis by 70%. And as I said, it doesn't increase the risk of breast cancer if you're on the right kind of HRT. If I say to my women, I am confident that your risk of breast cancer is your risk of breast cancer, but I'm not increasing that by giving you HRT. Obviously, you have to be monitored. Obviously, you have to be vigilant because you're a woman. But it is responsible for so few deaths, the breast cancer. And we have to put it all in perspective, really. It's about quality of life now as well, isn't it? So, and good health going forwards.
And finally, is there anything that you would say to anyone who was concerned about the link between HRT and breast cancer?
I think it's really important for women to get the correct facts, and therefore I would encourage them to see a menopause specialist if they really want to discuss that at length and find out all the facts.
Yeah.
And as I said, everyone's risk is different. People have different family histories. If they are overweight, that increases their risk.
Mm-hmm.
But that's something you can do something about. You can lose weight, and we encourage patients to do that.
Mm-hmm.
If you have 2 or 3 glasses of wine every day, that increases the risk massively. Again, that's something that somebody can choose to improve their risk. But certainly, talk to somebody who knows all about it and gets the correct facts so that you can make an informed decision about whether you'd like to go on HRT and for how long you'd like to go on HRT for.
Thank you very much to Dr. Tina Peers. We hope we've answered some of your questions, and if you have any more worries, we're going to put the links to the websites that Tina mentioned as well at the bottom of this.